MDMA and LSD.
Top 5 things that I should be alarmed by. Can therapy be harmful?
Yeah, you gotta be here in the hospital, they can force you. She has this smell. What kind of sentence was that? Really crazy.
Does every psychologist have a psychologist?
The answer would be no, not everybody. But the first years of training, or when you just started as a psychologist, you are supposed to have like a mentor, but that's more for your job.
Yeah.
But then, of course, in life, I mean, psychologists also have problems. And so we might also go as a private person to a psychologist, to get help when we get stuck in things. Yeah, sometimes we need help as well, also to get the perspective of somebody else's mind, to see you get stuck in your own thoughts. And so part of it is just hearing your own voice and also get somebody else eyes on your things.
Have you ever had your colleagues come to you severely depressed or with severe anxiety? Did it ever happen?
It has.
Really?
Yeah. Not depressed, but definitely with anxiety. And so we are all human, and we all struggle with different things. I mean, every psychologist, we also can have our OCD problem, or our stress about being perfect, or worry about sickness, or health anxiety, or
Yes. If a client comes to you and tells you, listen, I feel so bad and I'm so mad at this person, I hate them so much, I want to kill them. Or I feel attracted to like little children in a improper way. I know it's bad, but I still have these surges. What are you even supposed to do? Like, do you report them to police, or is there a protocol for this?
By law, we are forced to report only at very, very extreme a level of, if there's something about if this person would get a sentence, in prison for a number of years, for if they would tell me, oh, I'm gonna go out and put a bomb, there, I have a plan. Of course, I would need to report. Or if they say like, oh, I'm gonna kill myself, I'm just gonna go out and jump there. But it's only with those severe cases. So having thoughts of or wanting to do things, that's common. Then we need to talk about those thoughts, and a lot of people will have to get help with dealing with those thoughts.
Yes.
Wanting to be with kids, or wanting to hurt somebody. We will talk about how can we deal with those thoughts and sort of protect yourself for not doing what you don't want to do.
Are there misconceptions that drive you nuts as a psychologist?
I think we should be very very strict with what's a theory and what's a fact. So I get annoyed, if I hear somebody would say, oh, you had this dream, that means this, because we don't know. Or I heard somebody once said, oh, she has this smell, and that means that she had been like raped or something.
Has someone actually
somebody said that in a home, for people with problems, people who are living there, and I was like, oh, what kind of sentence was that? I think it's mostly about making conclusions about what happened in your childhood, saying, oh, this you must have been, something has happened traumatic when you were a child. I mean, I can hear clients coming saying that, oh, I had a psychologist telling me that when I was 3 months, this might have happened. And I would be like, how do they know this? Or that can be a problem, suspecting things. and it can lead to a lot of relational problems, you know, knowing my parents did this or didn't do this. So we don't know. We couldn't know what happened if we don't have facts.
That's actually one of the questions that I have. It seems to be this dogma in psychology that everything comes from childhood. Like, my dad was cold and inconsistent, and now I'm bad at forming relationships with men. Is that how it is? Is that how the modern psychology operates?
I mean, today we talk a lot about this 50-50. What you are in your genes is about 50% about, that's the theory, and about 50% what has happened to you in life. The answer is no. I mean, not everything is from your childhood, but of course we are different in our how much we get affected from our childhood. We can have the similar trauma, and some of us would get really, you know, big problems for that thing, or some would not. We are sensitive to different things.
Can therapy be harmful rather than beneficial?
I think it can, especially if you hear those kind of statements. You know, that this might have happened to you, and you would start worrying about things. So I think the psychologists need to be careful in what we are saying to people, because yeah, I think it can be harmful if it makes us worry about things that wasn't a problem before we went to the psychologist. It's important to know, I think, what the purpose is of our meeting. You know, what does the client really want to get out of this? So you got to be picky with your who you meet, that it matches you. Maybe somebody is good for somebody else, or you know, you gotta see what's a good chemistry.
If a person has severe mental health problems, can they be taken to the mental health hospital against their will?
Yeah, they can, if they are that severe that the system believes that you will kill yourself or you will severely harm somebody else. So it's only if it's such a, you know, strong belief that this will happen. But it's very strict. So just saying like, oh, I want to kill myself, that's, you know, not enough at all. It needs to be.
What is enough?
It can be like, I have looked, you know, which subject or which subway I'm going to jump at that station, sort of. Or I have planned, I've bought a knife or I bought a rope, and I'm you know, in this plan. So it's quite difficult to get actually locked in.
And
you can also be psychotic, but you don't get locked in or forced. I used to work in a psychosis department, and you can be super psychotic, but only if we believe that this person will kill him or herself, or really, you know, make somebody else suffer. That's the only way to get locked into the mental care.
Legally? And legally, how does that work even?
You come to the hospital and they make this, you know, you meet two doctors, and if both of them say, yeah, you got to be here in the hospital, they can force you.
I see.
Until they feel that you are good enough to let you out.
So it's possible.
Yeah.
Yeah. That's very nice. What are the top 5 things that we should do to improve our mental health?
I mean, we are very overloaded. Our brains are very, very overloaded with impressions, social media. We can do everything 24 hours today. We can work, we can mail, we can go shopping, we can go to the gym. And I think we need to understand that the brain is like any muscle. It can get strained. Like if you work out and you do it too much, you will get pain, and we need to see where our limits are. So we need to relax the brain so we don't get like overstrained. So I think that's very, very important these days.
And how to achieve that.
Yeah, and also how to achieve that. What's relaxing for you, or you. Is it just like taking a break, sitting in the couch, or is it maybe going for a jogging, or is it listening to your favorite music? It differs. So from time to time and from person to person, but just like getting away from all these impressions, maybe the visual impressions, maybe the noises. So I think a lot of people that has mental illnesses today would feel much, much better if they would just know how to regulate this.
So it's different for different people. Someone might need to shut down the visual stimuli. Someone might need to go into a quiet place.
Yeah.
How do you know? But maybe you just, how do you know?
I think the only way is actually to be very mindful and try and notice, and do like your own experiments. Like, do I feel relaxed from this? To be a bit curious and to try things. And even being social is very different. Some people have like a social battery.
That's very true.
For like 4 hours or something, then they need a break. Otherwise, they would get severely stress attacks. But if they just get the break, maybe go home for lunch, or maybe go out to a quiet place, they would be fine.
Yeah.
Like putting your iPhone in a charged battery.
Does it happen that a person takes a drug, they get intoxicated, they have a trip, and they just don't return back to normal? They keep tripping, they're developing these symptoms without the drug.
Yeah, it happens. When I worked in the psychosis department, I really met these people that what we talked about, this 50-50 with the genes and the world we're living in. It can be if you have some kind of genes, you can be very sensitive to drugs. So for one person, just one trip or one, smoking or whatever can be absolutely, you can be psychotic and end up in the hospital. And so me, myself, I would be very restrictive, I'm very afraid of that. Because I know that it could happen if you are that kind that has some kind of sensitivity. So you should also look at your relatives, what kind of genes you have, what sensitivities you have.
So if your grandma, let's say, had schizophrenia,
yeah, you should be extra careful
with drugs.
Yeah.
What's worse for mental health, drugs or alcohol?
Well, now it differs. Drugs. There are different type of drugs. Actually, it's quite up and coming with some drugs. I think will be a treatment soon, like MDMA and LSD, and some drugs are actually up and coming for treating trauma, treating depression, treating even substance abuse. We're not there yet, but I heard they started this in some countries. So you couldn't say like drugs as all kind of drugs. It depends. I think alcohol, you would need to do it for a while to get really bad effects. But a drug, some kind of drugs, you can get bad from one trip, and you would be really crazy. I mean, you can get brain damage. But alcohol, you would need to work it up.
Is it possible to die of a panic attack?
No, it's not. No, it's not. But it feels like it. So I can I mean, a lot of people will say that they really felt like they are going to die, and they go to the hospital and they get super afraid, but it's not dangerous. It's just your alarm telling you, um, to watch out for something.
Are these psychosomatic illnesses real? Like you think you have cancer, or you're just very sad and stressed and you do get cancer, or you actually have cancer, but your thoughts make you recover in some way.
Yeah, it actually, we can heal ourselves. I mean, through we don't want to have an inflammation and cortisol and stress. So if we are, thinking thoughts of a lot of anxiety, and we would get, a lot of stress hormones in our body according to what we're thinking, that will give us more inflammation, and our immune system will be worsened. If you have a long time of stress, lots of cortisol in your body. But if we turn it around and instead you can shut this alarm off, and don't have the body pouring out stress hormones, this will heighten our immune system and make us healthy.
If I go on a date, what are the top 5 things that I should be alarmed by in a guy from a psychological point of view?
No, that's a difficult question.
Or not even go on date, like start a relationship. Maybe some things can turn up later, and I should pay attention to that.
Well, of course, it depends, what you are afraid of. We all want different things in a relationship. So it's a bit, we couldn't say that watch out for that, because you don't know what kind of relationship do you want. Some people maybe want a very flat, straight relationship, no drama, calm. And some people maybe want a bit of a roller coaster.
Is that healthy?
I think it depends on, how much of it. It can be destructive, or it depends. I would say, how much challenges you will have. But I think generally, I don't think anybody wants somebody that would be not empathic. So at least that, I think we can all have as a red flag, looking for if somebody is like not at all thinking about your perspective or your side of the story, how you feel. If somebody is like 100% thinking of their own and doing what they feel like or want with you, without respectful questioning or so, I think that would be a general red flag.
Is it easy to identify this? Because if they lack empathy, they might be able to mimic empathy. Is that not so? To exist in the society.
I think the people who really lack it, they don't really even think of it. Trying to. I know when I did a lot of assessments out in, people in jail or in youth homes, like criminals or so. I usually went out and had maybe a coffee. Like I was working in a clinic or in this institution, and I could have like, oh, should we go out and have a cigarette, or should we go out and in the coffee room and have a coffee? I always thought that was important, because then I could get small signs of that. Would they want to pour me coffee? Would they want to, open the door? I was looking for those small signs. Would they, light your cigarette as well? You could tell a lot by small,
just mechanical things.
Yeah,
you don't think about.
No, just seeing small signs of being able to think of the other person.
Are there any ways to be able to detect a person who will be abusive later on in the relationship?
I think you could probably notice this with the empathy part and also maybe control issues. If you would notice that the person is suspicious or wanting to controlling you, or I think those are the traits that you should be a bit aware with.
Is there a psychological way to make someone fall in love with you?
A psychological way to make someone fall in love with you. Well, there are theories about that. I think the recipe for love is becoming the best version of yourself. And then I believe that you will attract the right people that want you for being you, 100% you. So the more you will work on being who you want to be to the fullest, I think that would be the recipe, to attract the right people, the person that would match you.
That's a very
So
good
working
thought.
on yourself and not how to do you see the difference?
Yeah, the focus.
Yeah, the focus, instead of being how would I make myself attractive, no, instead, how would I be, how do I want to be, and how can I make myself that, to the fullest.
Yes. Do we control our brain, or does our brain control us?
It's a good question, and I believe the answer is both ways. That's what I think is really cool with the brain and the chemistry. It's the brain and the chemistry will affect you, and you and your acting and your environment will affect the brain. So it goes both ways.
Do you ever watch popular celebrities or politicians and think, oh, that one definitely needs some therapy? Does that happen?
It happens. It happens with some very, very crazy ones, according to my opinion. I would think, what's going on in this person's mind?
Yeah.
So I think, that can happen.
Can you name some famous person, dead or alive, that you can definitely say that they have this diagnosis, like this personality disorder or something like that?
The diagnosis I'm thinking of is easier than the person. Now I'm not having specific persons, but I would say very autistic traits are easily to spot.
What are those actually? I have no clue.
Yeah, that's a person that has some issues with being social, being a bit more like a robot, maybe not understanding small social cues. Maybe if somebody says something, they take it, we call it literally. I think these traits are very charming and usually a likable person, but it's a bit, the nerdy type. That, oh, I thought you meant this. And among politicians, maybe it's more of the narcissistic, or sometimes you wonder what's the agenda for this politician, want to conquer the world.
If you could ask psychologists anything, what would you ask?
Are the classical psychologists still relevant today? Whether it be Freud, Adler, Carl Jung, or whoever.
Psychoanalysis is more about understanding what, a lot about your childhood, like what made you, theories about what made you, having these problems. You're looking for reasons, if I generalize it. And CBT, that has been popular for a while, that's more about, so, okay, you are who you are, how do you work with changing your thoughts or your behaviors? So it's more about progress and how do you want to be, change, how do you change your thoughts. But then the third wave which I'm actually quite into, which is acceptance and commitment therapy, which what I like. That's even one step further. It's not even necessary to change your thoughts. It's more about seeing your thoughts and acting like you want to act with your thoughts. So you don't even have to take away your thoughts or change them. You just have to relate to them in a different way, so you're not hindered by them.
Is it a myth that humans only use like a certain part of our brain?
It is a myth. We are definitely using all parts, and before we thought much more that okay, this area is only for that behavior, and this area is for that behavior, and this area is for that behavior. And today we know that it's much more centers. If I'm behaving and doing something, say musical, it might be both there and there and there. So it's more complicated than we maybe thought before.
How does spending your days with people with psychiatric diseases influence you?
I learn a lot from people with different psychiatric diseases. I understand that we are all we have qualities and we have difficulties, and so I get actually inspired, and I also think I have met very beautiful people in psychiatric clinics. A lot of talented people, very intelligent and creative. So we should know that even a people living on the street can be the most intelligent. Actually, the most intelligent person IQ-wise that I met, he lived in an institution and picked up garbage from
Really?
the can or the garbage bins.
Wow.
And then he was like highest IQ. So
I'm bewildered.
Yeah. So we should.
But why did it? Do you know why he was in the circumstances he was in?
Brain gets too, overloaded with all your facts and all your,
Wow.
So and it's not so uncommon. So you should never be judgmental. Because what you see is not what's inside this person.
Definitely.
It can be the most creative, artistic person, and that's there's even a link between the traits. Being extremely creative and a little bit crazy is not, there's a fine line.
Yeah, for sure. So is every genius a madman then?
No, I wouldn't say every genius, but I would say if you are the best above all, you are not normal.
Yeah.
Because normal is what most people are, and you got to be a bit not normal to be the best.
Yeah. There's this thesis that life on Earth has become much more comfortable and easier, but people are much less happy. Is that so?
There is some truth in this. Of course, people have always been suffering from different things. I mean, we had slaves, we had horrible situations, diseases. But I think there is a connection between when we have all the basics, we have our house, we get our food. Of course, there will be different challenges, and we will. I think today's trend is the biggest issue is the comparison with the social media, and that we can all compare ourselves with the whole world. And comparison makes us easily feel not good enough, and that's very, very stressful for many people. And also with all the possibilities, it's not always good to have so many possibilities, because then a lot of people would suffer from, what should I choose? Should I be this, or this? So you can say it's a luxury problem in a way, but still it doesn't make it easy. Then if you would be born and you would be, oh, this is what you should be, and you would be proud of being this shoemaker or whatever, and you will feel comfortable and no questions.
And how do we stop comparing ourselves to other people, especially with the social media? We see all these super successful people who make $2 million a year at the age of 19. How to be in peace with yourself.
No, that's a challenge today. And my recipe for it would be to be mindful and understand that we all have qualities and difficulties, and usually I compare my weaknesses with your strengths. So when I compare, oh, I'm so bad at this and you're so good at that, well, first of all, it doesn't need to be that way, but it might be, and then I might have other qualities, and you will struggle with other things, and so not to try to be somebody else, but to really more wonder, how can I be my best person? And also, I think a lot of people, young people that I meet, they have also noticed that they actually need to unfollow some people, because they feel like, oh, I cannot stop comparing myself, if this person doing such great stuff all the time, it's affecting me too much. Or maybe think of when you watch these videos, if you're down, if you have a bad day or so, you haven't slept, you might be having PMS, or maybe it's not the day that you should look at those videos, or you're not strong enough today, maybe look tomorrow instead, to ask yourself.
That's a very good advice. And once again, you mentioned the self-focus thing, so maybe it can be applied to many areas.
Yeah, it can. I think that's the key to a lot. To put your focus and your energy to yourself and not to others. You can get inspired from others. You can look at, for inspiration and learn things, but to really see the limit when this is becoming destructive. And also, remind yourself of the time people have spent, because we only have a certain amount of time. So for instance, if somebody can make this yoga pose, this person probably dedicated extremely many hours for being able to do that. And maybe you don't want to spend all those hours to be able to do that. You are doing other stuff with your time. So think about, one step further.
Hey guys, this was one of my Ask an Expert interviews, so if you liked it, give it a like, follow this channel, and let me know who I should interview next in the comments. Bye!